Okay, I'm Christy Carpenter, and I'm taping my week 7 evaluation project. And this is my mother, Shirley. She's going to be my patient. Were you going to say something?
Hi.
So anyway, I'm going to do my exam first, my physical exam first, so you can see that, and then I'll add the questions and the rest of the responses after the exam. So we'll call you Billy.
Okay.
So Billy, tell me what's going on. You're having problems sleeping, I hear.
Yes, I can't go to sleep at night.
Okay, how long have you been having problems sleeping?
Several months.
Okay.
It's just when I lay down, everything just races through my mind, and I just can't get my mind clear to go to sleep.
Okay. And this is not a new problem. It's been going on for a while.
Been going on for a while.
Okay. Okay. Well, I'm going to listen to your lungs, kind of do an exam, and we'll talk some more. Okay? So let's listen to your lungs first. Take some breaths for me. And I'll reach around you and we'll listen to your heart. And I'm going to do a full neurological exam, including the 5 cranial nerve, or the 8 cranial nerves, and the eyes, ears, nose, and throat. I don't have a otoscope or ophthalmoscope, but I would check the eyes for the red reflex and the papillary edema and any variation of the vessels, any vibration of the vessels in the eye. And I would check the ears, the tympanic membrane, touch the tragus, and see if that caused any pain or anything. Also would tap the facial bones to see if there's any complaints of pain or anything. Look at the nasal turbinates, describe any drainage or any kind of inflammation or anything that I see. Look in the oral cavity at the oral pharynx and see if there's any signs of infection in the tonsils or any pustular places on the tonsils or any rash or redness inside the throat. Also, I would be concerned about a thyroid disorder with a hyperactivity, so I would be sure to do a thyroid exam. If you'll turn your head, kind of look up a little bit. So you'd want to move the thyroid very gently and examine one side and then the other. And then check the neck to see that it's supple and that there are no masses or enlarged nodes or anything. And also feel for cervical nodes. And then I would want to do, like I said, a neural exam. I would want to check all the reflexes, the arms and legs and the feet. And I would want to do a Babinski. And I would want to check the abdomen, make sure there are no masses and that it's not tender. I would ask about constipation and bowel movements and urination, as there might be some thyroid issue involved. And I would do, considering this is a pediatric patient, a Tanner stage, but that part will be deferred on this exam. And then I would also want to ask Billy to stand and to bend forward from the waist. And I would check for scoliosis or any kind of spinal irregularities that I might see or anything. You can stand up now. Go ahead and have a seat. And also I would want to see Billy walk. I would want to check gait and see if there are any irregularities in the gait. Also, I would want to observe how Billy sits. Is he busy tapping his foot? you know, is he able to sit still and for how long? Attention span, short things that I ask him to do, like to stand up and bend over, is that easy for him to accomplish, or is he very active and playful, or, you know, uncooperative in the room? Does it make him mad or angry when you ask him to do things? That kind of thing. And that would pretty much be the end of the physical exam. And like I said, I will add on to this physical exam the questions and any further assessments and that I would do while I'm doing the physical exam. Thank you very much.